Going Beyond is a presentation of Beyond Housing, helping entire communities become better places to live with RareGem Productions. Reliance Bank, your locally owned hometown bank, is pleased to sponsor today's Going Beyond radio show. With 20 locations throughout the St. Louis area, Reliance Bank is making money a little friendlier.
Member FDIC and equal housing lender.
We're going beyond.
Today on Going Beyond.
On today's show, we're going to talk about the exciting development happening on the corner of Page and Ferguson in the beautiful city of Pagedale.
So what this is actually a community outreach center. What will occur in the center is that we're going to kind of really focus on some real needs of the community.
We need to do a lot of in-depth education and assistance in need. So there's a need, definitely a need. I mean, you can look at the statistics and tell it's long overdue.
Joining me on today's show is the mayor of Pagedale, Mayor Mary Carter, and also joining me on the show is the director of the St. Louis County Health Department, Dr. Dolores Gunn. Welcome, Dr. Gunn.
Beyond Housing is going beyond.
That and more ahead today on Going Beyond with Chris Krehmeyer, right after this. Reliance Bank is the proud sponsor of today's Going Beyond radio show, a St. Louis community bank with 20 convenient locations in the metropolitan area. Reliance Bank offers the friendly personal service that only a community bank can provide while delivering state-of-the-art banking products and services competitive to the big bank. Let Reliance Bank help you get what you need from your bank. Call Reliance Bank at 314-569-7200, 314-569-7200, or you can find Reliance Bank online at RelianceBankSTL.com. Reliance Bank.
Member FDIC and equal housing lender.
This is Chris Krehmeyer, host of Going Beyond and the president and CEO of Beyond Housing. I am issuing a challenge to all the mayors in the 24-1 initiative. Saturday, October 25th is the 4th annual Beyond Housing Health Festival and the 4th annual Fun and Run. Last year, the city of Bonita Park was the winner to get the most residents to come out and participate in the walk and run. Folks in Greendale and Pagedale came in a strong second, but this is a challenge to every mayor in the 24-1 footprint. Get your residents out. You can win the big trophy, take it home to your city hall, proudly display it for the following 12 months. But even more important than that, come have your residents come out and get healthy, get a flu shot, participate in the healthy eating classes, participate in the many other things that are there for your health festival. Saturday, October 25th at St. Vincent's Community Park, 7335 St. Charles Rock Road in between Pennsylvania and Ferguson Avenue. 9 a.m. the run starts, 10 a.m. to 1 o'clock will be the festival.
We're going beyond.
Welcome to this edition of Going Beyond. I'm your host, Chris Krehmeyer, President and CEO of Beyond Housing. On today's show, we're going to talk about the exciting development happening on the corner of Page and Ferguson in the beautiful city of Pagedale. Joining me on today's show is the mayor of Pagedale, Mayor Mary Carter. Welcome to the show, Mayor.
Thank you. Glad to be here.
And also joining me on the show is the director of the St. Louis County Health Department, Dr. Dolores Gunn. Welcome, Dr. Gunn.
Thank you. Thank you for having me here today.
Mayor Carter, for those who may have driven down Page Avenue and have seen some dirt moving around and some concrete getting poured, you want to tell folks about what's happening on that corner and why it's so important to you and then the folks in and around Pagedale?
Well, first of all, the clinic, the health clinic, the services that will bring, that is the most important one. But there'll also be some retail and also the movie theater, which will be good for the community and the surrounding communities. All of these services will be available to not just only Pagedale residents, but the surrounding communities.
And Mayor, you had mentioned earlier there was the recent East-West Gateway report about some disparities in the St. Louis region relative to a whole number of things, including access to quality health care.
Health care, yes. That is not only having access to quality health care, but not having health insurance. That is one of the things. So if you don't have the insurance and you don't have access to it, you're even worse. Plus, if you look at that East-West Gateway Coordinating Council's study, it talked about a number of things. And that's some of these conditions, the reason you need these facilities in these areas is because of unemployment causes stress. high blood pressure. All of these things are intertwined and connected to each other.
Yeah, so Dr. Gunn, that particular facility is a community services facility that St. Louis County, the health department along with the Department of Human Resources has committed to occupy the top floor, 6,000 square feet of space. So maybe you tell our listeners a little bit about what's anticipated to be in that part of the community services building.
Absolutely, Mr. Krehmeyer, and also much thanks to Beyond Housing and Mayor Carter for their support. But what we're looking at in St. Louis County is when we do an assessment of our community as a whole, when we do assessment of St. Louis County, which is part of our job, we look at the needs of the various communities within St. Louis County. Now, there's an obvious need based on not just the health department's community assessment survey, but the strategic plan of the county calls for services in that area. The Human Services Department's assessment calls for services in that area. So we have the information and we have the data and we have the science behind that justifies the need. So the question is, what do we do about it? We know what the situation is. We know what the science says. We know what the assessments, once we've assessed our community, says. So what this is actually a community outreach center. What will occur in the center is that we're going to kind of really focus on some real needs of the community, not just people who need access to specific types of health care. And here we're really also focusing on individuals who are uninsured, Medicare or Medicaid, but primarily Medicare. Because one thing we realize, especially for those who are over the age of 55 and up in that region, a lot of the physicians, the private physicians who once practiced in that area have left because the reimbursement was just too low. So now you've made a population who was vulnerable, and you've made a situation even worse, where you have people, especially those over 55 years of age, who can't get access, lack transportation, and really need access to either specialty care or adult medical care. So bringing those services into the community is critical. But in addition to that, there are other needs. There are counseling needs for those who are our older residents in the community. There are counseling needs for our youth in the community. So this is not just about health services. This is about us all-around, wraparound social services. And I just really want to say that Andrea Jackson-Jennings, who's the Director of Human Services, has played a key role in helping us put this together. So we're not looking at just, quote-unquote, a clinic. We're actually looking at a community outreach center that meets the holistic needs of that community. And where they're located, I think, is quite strategic. And
clearly, we've seen all the data that tell us, as you said, Dr. Gunn, that it's more than one thing occurs in somebody's life. There's lots of triggers and opportunities for very specific things. But again, if you're struggling on the healthcare side, there's a great likelihood you got something else that's a bit of a challenge in your life as well. And can we provide an opportunity and access to all kinds of resources that can help individuals and families become stronger and healthier. Mayor Carter, when you think about the work in Pagedale, from the grocery store to the senior building to the bank, what's your sense of how this community outreach center is going to continue to add to the momentum that has been building in your community over the last several years?
And you know what, I agree with Dr. Gunn. That is one of the key things that they need is access to health care and everything. But they also need other things like counseling. Some of them just need counseling. We have in this area a lot of mental problems and drug problems and alcohol problems, and all of these things can be dealt with, some of them through counseling and some of them through referrals. So I'm hoping that there will be a big referral piece to this. I don't know, but that would be great. Having the bank and the grocery store, that gives them access to healthy foods, which they would not have. And that is a main thing, having the proper diet, not being overweight, and eating healthy foods. So that helps. And banking, they don't tend to go out and have to pay these check cashing places money to cash their check. They can have access to banking. Seniors and younger people who do work, because they're not making any money as it is, and so they need to have as much money that they do make, because most of them are unemployed or underemployed. And so they need to stretch their dollars as far as possible, because almost 50% is paying more than 30% of their income on housing. They need to stretch every dollar to the longest point.
Mayor Carter, you hit on an important point that we got a lot of folks in the community who are either unemployed or are underemployed relative to their income capacity. So your data point there about more than half the people are paying more than 30% of their income for their housing means that something else has got to give in their budget. And
That's true.
And again, what are you going to sacrifice? Are you going to sacrifice food? Are you going to sacrifice utilities? Are you going to sacrifice prescriptions or other parts of your health care? So again, what's trying to be done not only in Pagedale but in the entire 24/1 initiative is, can we align the resources that folks in the community need to lead healthy and vibrant lives? Dr. Gunn, I saw you nodding your head when Mayor Carter was talking about a kind of referral system, that it's not simply come and see one doctor and then you're done, and how do we address the multifaceted challenges that some folks in our community face? Can you talk a little bit about how you and the Department of Human Services with Ms. Jennings think that this referral system could work at the Community Outreach Center?
Well, actually, what we're looking at is more of a holistic approach to an individual, because you can't treat the body and not treat the mind, and you can't treat the body and the mind and ignore the environment in which the individual lives in and works in. So what we're looking at is providing not only access to health services that are desperately needed in the area, but also counseling and referral services and even classes that could be offered to the community directly up there. So when I say that this is a St. Louis County Community Outreach Center, that is exactly what it is. This is a St. Louis County Community Outreach Center. So that if you're coming there and you're an older resident and you want to know something about, how do I get assistance with something in my home, either air conditioning or minor repairs that I may need. If you are a younger person and you're having some issues with some of the younger kids in your home and you want to do something around substance abuse prevention, or you want to get linked to the Children's Service Fund, that space in the area will be specifically used for that. So we're talking about using that space to meet the holistic needs of the community so that we have a sustainable community. Not only should you have access to fresh fruits and vegetables in your community, you should have affordable housing, you should have access to care, and that includes mental health, social services, and physical health services. And that's what that is really all about. So those services actually will be physically on site. The medical services end of it will actually share physical space with the social end. Actually, there's more square footage for the social services, believe it or not, than there is for the medical services. And we purposely made it that way. Another key point I want to mention about the Community Outreach Center is it's not your traditional, I just need to say, internist. In the region, we have suffered, especially when it comes to access to specialty care. With the closure of Connect Care, which was one of the main sites that a lot of lower income and uninsured individuals use, we no longer have that site. A lot of our partners at SLU and WashU have really stepped up and tried to fill that void, but the services have been decentralized. And a lot of the people who live in St. Louis County, particularly the north part and Pagedale part of the county, need to access those services. And this site, in partnership with our friends at St. Louis University, WashU, or the medical services there, could also use that space as a place for specialty services.
So again, this is an exciting kind of new way to think about delivery of services, and not in our traditional silos as we have historically done. Right. And I think kudos to Dr. Gunn and Andrea Jackson Jennings for thinking a little bit outside of the box and pushing kind of what can happen in this facility, recognizing the challenges that folks in the community face. Mayor Carter, when you think about again the challenges that your residents face and then what you see and hear and what your constituents tell you on a regular basis, how busy do you think this facility is going to be once it opens up in about a year or so when the construction's done?
From what I hear, they will have more clients than they'll be able to handle in the beginning. And I'm sure will always be someone there, because when you look at our infant mortality rate, it is almost 4 times that of the general population. So we need to do a lot of in-depth education and assistance in need. So there's a need, definitely a need. I mean, you can look at the statistics and tell it's long overdue.
We're all excited about it, so let's see if we can give a quick update on the construction. So there is indeed a concrete being poured. So on the Community Outreach Center. The foundation is being poured as we speak, and the movie theater that's next door, and we'll start pouring the concrete footings for that facility sometime in the next 2 weeks or so. We believe that the movie theater will be open, my hope is, in August or September of next year, and that the Community Outreach Center will follow that a little bit later after that, as all the finishing work in that building gets done. As a reminder, the Outreach Center is 6,000 square feet on the second floor of a building, and the bottom 6,000 feet will be retail of some kind. So we're talking to folks at the Subway sandwich shop. We're talking to a few other folks. We've actually had a preliminary conversation with optometrists who may be interested in a piece of the bottom floor. So again, some exciting opportunities for that facility to really create a town center. So again, if folks haven't driven down Page Avenue, particularly the corner of Page and Ferguson, I encourage you to get in your car and drive and kind of look at the changes, and then please stop in at that Save-A-Lot grocery store and buy a few groceries too, because that always helps the cause as well. Dr. Gunn, any last thoughts for our listeners about what's happening in this facility, what the county is trying to do, and what we're trying to do as a partnership here, not only with the city of Pagedale, but in the 24-1 initiative?
I think that as far as St. Louis County is concerned in our efforts, it aligns quite well with the needs of the community based on what basically the community has told us, and also based on the scientific assessments that we've done. The information and the data and the statistics are there. You're correct. We have a higher infant mortality rate. We have a higher incidence of unemployment and underemployment. We have over 50% of the population who have limited or no access to services in that area for medical services. And then we have a higher incidence of those who are over the age of 55 having access to geriatric care and services, and almost no immediate access to specialty care services. We also have social service needs in that community that must come together. So what we're saying is we think, in conjunction with 24-1 and the vision that the community has for itself, we're just happy to be a partner in that and be able to deliver the services as we are supposed to as a government, because that's what governments do. You deliver the services to the people who pay the taxes. And last time I checked, the people in Pagedale, on Page and Ferguson, do contribute to county treasury. So yes, these are the services they deserve. Yes, indeed, they do. So fantastic. So Mayor Carter, some closing thoughts about this facility, what we're trying to provide there, and the overall direction of Pagedale and the 24-1 initiative. I wholeheartedly agree with Dr. Gunn about the need. The need is there, and I'm just hoping that this will have a rolling effect to bring other things. In this area, we don't have a pediatrician. We don't have a dentist. We don't have those type services that we need in this area. So I'm hoping that with the opening of the clinic and some of the other retail and things like that, that we can attract doctors, a dentist. I mean, that's very important. So young people will have access to cleaning and cavity and checkups, dental checkups, which some of them don't have access to. I'm hoping that we can get a dentist, a pediatrician, and other services that we need, as well as add to what we have. Well, for my listeners, you just got a chance to listen to two of what I believe are the finest community servants in the St. Louis region that I have the great fortune to work with on a regular basis. So please recognize that what they have done for this region. Come join us on the corner of Page and Ferguson. Dr. Dolores Gunn, Director of St. Louis County Health Department, thank you for being on the show. And Mayor Mary Carter, a longtime mayor and my partner in the city of Pagedale, thanks so much for being on the show. Thank you for having me. Thank you.
Reliance Bank is pleased to sponsor today's Going Beyond radio show. With 20 locations throughout the St. Louis area, Reliance Bank, your locally owned hometown bank, is making money a little friendlier.
Member FDIC and equal housing lender.
We're going beyond.
Going Beyond is a presentation of Beyond Housing, helping entire communities become better places to live with RareGem Productions. Proudly promoting, presenting, and producing positive programming.
Neighborhood is where you live. and we want to keep it strong and vibrant. This is Chris Krehmeyer with Beyond Housing. We are going beyond.
Chris Krehmeyer, President and CEO of Beyond Housing, located at 4156 Manchester. Phone number 314-533-0600. The only organization in the St. Louis region that offers access to affordable housing. Wherever we work, our goal is to help transform people, families, and communities so that they achieve the skills, strategies, resources, and commitment to succeed for the long term. See our work at beyondhousing.org. Podcast for Going Beyond can be heard, downloaded, and shared by visiting hallelujah1600.com. Listed under the music tab, on demand. Going Beyond is another positive production of RareGem Productions.
This is Chris Krehmeyer, host of Going Beyond and President and CEO of Beyond Housing. Please join us for the 4th Annual Health Festival, Saturday, October 25th at 9 a.m. at St. Vincent's Community Park, 7335 St. Charles Rock Road. There will be flu shots, diabetes screenings, cooking demonstrations, children's fun village, a host of great activities. Saturday, October 25th at St. Vincent's Community Park.
RareGem Productions proudly presenting the positive.